I've been really excited to have this conversation. So thanks for making the time to come out. And I don't know that everyone knows, for our listeners or the folks that will pick this podcast up, who Fresh Start is and what it is that your organization does. So I do want to introduce that a little bit here in the beginning, and then also introduce you guys and have you introduce yourself and kind of your role with the organization.
Sure, my pleasure.
Cool.
Okay, I am Michelle PIUS, and I've been with Fresh Start since 2010. Fresh Start is the happy ending children's medical organization. Our kids come to us with physical and cosmetic deformities caused by accident, disease, abuse, and of course, birth defects. And they are children that are really without resources. We are the safety net for plastic and reconstructive surgery. Our kids are uninsured, underinsured, don't qualify for a state-funded program, and their parents typically are lower income without the resources to pay for corrective surgery. We are more relevant than ever right now. The pandemic caused a financial crisis, which caused millions of people across the United States to become unemployed in an instant. There's never been an instance where today you're employed, we had full employment, and by the time the week was out, millions of people were unemployed. What goes unsaid is the day people lost their jobs, they also lost their employer health insurance. So we have families that never in a million years dreamed they would be seeking out charity care for their child are now coming to Fresh Start. And I like to say Fresh Start is not charity care. We are highly specialized medical care that we don't charge for.
Right. That's the part that blows my mind, because when you did the math for me, when you did the math for me, what a donation of $10,000 is equivalent to in medical care is something like...
This is my favorite part. Put me in front of a bunch of accountants and finance people to explain how we're able to do what we do. Is all of the medical care and the facilities are donated. So what we're doing is we're leveraging the donation of highly specialized medical care, nursing care, in a lot of times pharmaceuticals and the OR cost against the actual cost. So a surgery weekend cycle, which is 8 weeks, which includes a marathon day of surgery, clinic days, follow-up appointments, dental clinics, and orthodontic clinics within that 8-week cycle, we're providing anywhere from $400,000 to $600,000 of care, and the actual cash cost is about $55,000 to $85,000. So we've got the multiplier effect. And so if a donor is looking to stretch their dollar as far as it can go and really put it to its highest and best use, a donation of $10,000 to Fresh Start translates into $50,000, $60,000 of medical care.
It's better than any investment that you can make in yourself or anyone else. It's unbelievable.
It also has to do with, in the state of California, doctors are not employees of hospitals, so they can do surgery and it's up to them whether they're going to charge or not. Of course, nobody charges Fresh Start for anything. So we do have, just the way California, the labor laws for medical are set up in our favor. So that's what we do. So Lupita is really the expert on how children can become a Fresh Start patient. I'm more of, in generalities, this is who qualifies, but how to become a Fresh Start patient and the conditions that we cover, it's really Lupita's sweet spot. So I'll turn the mic over to Lupita.
Good morning, Lupita.
Good morning, Logan.
Good to see you as always.
Thank you.
Of course.
So my name's Lupita Morales, and I've been with Fresh Start since 2007. And Michelle and I have been working together to expand Fresh Start and just get the word out here locally in San Diego and hopefully across the globe. But like Michelle was saying, my part is to screen the applicants that qualify for Fresh Start. There's children that we see from all over the world. And the first part is they have to complete an application, and they can do that online at our website, freshstart.org. And they complete the application. The application is a 2-page application. They just have to state what their condition is and if they've received treatment for it, and if they've had previous medical records or previous treatment for the condition. Then all the applicants are presented to our medical committee board, which is made up of all our volunteer surgeons. And then we decide if that patient or that case is within our within their scope of practice.
Got it.
So if they're approved, and then they're chosen to come to San Diego, and surgeries are done at Children's Hospital. And depending on where they're coming from what part of the world, I help them do all their paperwork, their documentation, their passports, and their visas. And we also arrange their travel and their lodging, and we take care of all the logistics that need to happen for them to come here.
This is what's so impressive about your organization, and what you two, along with your team, have done, in my opinion, is the network that you've developed to manage the logistics, to manage the surgical care provided by the doctors, by the surgeons, the floors, the facilities, the equipment. All of that, again, as you said, Michelle, is free. And to Fresh Start, that requires a really, really special kind of group of people to secure that on a regular basis and be able to guarantee it, as you said, which is, I just can't get over it, honestly.
The partnerships that we've established, I mean, they've been partners for years.
Yep.
And they're still here supporting us, especially during this time. Like Michelle was saying, with the pandemic, a lot of people have lost their jobs, and a lot of people have lost business. But here we still have, for example, we have a big chain. I don't know can I say the names of a chain? Yeah. It's Jimbo's.
Sure.
Jimbo's. Yeah. They support us, and they provide free food for our volunteers. And she was reaching out to me, asking me, "Are you doing your surgery weekend?" This was back in July, and I said, "We are not." I said, "We might do it in September. I will be in touch." And even though I'm sure they've lost sales, they're still willing to help us. So I was in touch with her, and I just said, I don't need as much food, but we do need some, but not the full amount. And just the interest that she shows, that they're still willing to help, and they're reaching out to us. That's a huge thing for me.
I agree. That
I see everyone is still wanting to know what's going to happen with the program, what's happening with Fresh Start. And luckily, we are doing our surgery weekend next weekend. So we're starting with a limited number of patients, but slowly we will begin to establish the full number of patients that we used to do regularly on a surgery weekend.
Very cool. Very, very cool. And Michelle, you mentioned surgical weekends a little bit as well on the surface. And I know that you've just talked about, could you walk us through just, I've been to a surgical weekend, so I understand. But when we talked about it initially, it was easy for me to understand, in a discussion, but being there is something really, really special. We were able to meet some of the patients. We met you, Lupita, and saw clearly all of the work that gets put into a surgical weekend by volunteers, by your team, by donors, whenever they do the walkthrough. But I think if you could kind of give us start to finish, what does it feel like to be? And I'm curious to know also from your side, what does that look like? I'm sure it takes a ton of work.
So patients start arriving a week prior to surgery weekend, depending where they're coming from and depending on what type of surgery they're having. Sometimes they need it might be 1 week or two, depending again on the surgery, because they might need special labs, special x-rays, special testing. So they usually arrive a couple days, if it's not a big surgery, a couple days before. So they arrive at the airport, San Diego Airport. They get picked up by one of our drivers. They get shuttled to our partner hotel, which is Homewood Suites, in Hotel Circle by the Hilton, which they're amazing. They treat our patients. It's like they're home away from home. We can't say enough good things about them. And they, that's where they stay while they're here. And then they might have appointments. They might have to go to a hospital for special lab work. Our driver takes them. It transports them to whatever appointment they need to go. Then on Thursdays, we have our pre-op clinic, which is at our Fresh Start Clinic on Frost Street in San Diego, down the street from Rady Children's. And we do, we go over with them with what the surgery's what's gonna happen the day of surgery. If they have any questions,
start getting them comfortable about what's gonna happen day of.
Exactly. Cool. So we go through the paperwork, all the consents, and then Saturday morning, they're picked up by one of our drivers at the hotel, and we start really early on Saturdays. Mm-hmm. Some of the patients have to be there at 5:30 in the morning, right. And then they get checked in. They are screened prior to surgery, and then they have a visit with the surgeon and the anesthesiologist to explain to them what's going to take place and what's going to happen, what to expect. And then after surgery, they are there in recovery for an hour or two once they feel they're fully woken up. And if they are an inpatient, they are transferred to the second floor. And if they are okay to go back to the hotel, they go back to the hotel, where we have an overnight nurse that stays at the hotel and checks up on all our patients. So that's Saturday night. And then Sunday morning, we have our post-op clinic, again at the clinic, and the doctors, surgeons come back and they follow up with the patients that had surgery the day prior. And that day is a busy day because we have multiple clinics going on that day. We have a speech clinic, we have a laser clinic, and we have our post-op clinic. So that's Sunday. But in between those 2 days, so much planning has to go from the medical side.
I can only imagine.
To make it happen. Mm-hmm. So from my end, I leave my house on a Friday morning and I don't get back home till Sunday night, because I have to stay down in San Diego to make sure everything goes as if anything might come up. I just need to be down there. So, I mean, I've been doing it for so long. I know what to expect. And sometimes things happen, but we just have to move forward and fix it. And I mean, luckily we have a great team. Everyone's very committed, and we make it happen for the kids, because we know at the end of the day, that's what it's all about. Mm-hmm.
And, you're dedicating an entire weekend and, but so much more, right, to these families and these kids. And we say kids, youth, right? In most cases, most of your patients fall into either infant or teenager, but then somewhere between infant and teenager age range. Is that correct? When you take a patient?
Yes. So we are a pediatric organization, but unlike a lot of other social service agencies, our kids never age out. So they don't have that stress of having to find care elsewhere once they turn 18. So I want to say the majority of our kids are done in their late teens, early 20s. But our commitment to each child is until the best possible outcome has been achieved. And that is decided between the patient and their surgeon. We never say, we've spent a fortune on you, we're done. That is really important. The kids have a lot of confidence. The kids start talking about feeling happier about themselves, feeling more confident, more self-esteem, but more importantly, self-love. They look in the mirror and they like who they see. And the parents really, a lot of times, especially in less developed countries than the United States, a child with a birth defect is a surprise at birth because they likely have not had the prenatal care. If you've been going to the doctor, you are prepared for a child being born with a birth defect. So a lot of times in other countries, it's a curse upon your household. They keep the child in the house. They don't go to school. They really have no chance at a life. And the parents don't understand what they did wrong to have a baby that wasn't born typical. And we really educate them that these are random occurrences in many, many times. And not only does the child start feeling good about themselves, the parents feel comfortable taking their child out in public because now they have the answers. If somebody in the line at the grocery says, "What happened to your child?" they can say, "My child was born with this condition and we're getting it fixed," and it diffuses an otherwise anxious situation. So we've really, especially Lupita and I, have had personal experience with parents that literally had no idea what was going on. It was confusing at birth. And we just make it known that we are going to take care of you. I remember Viviana, who is an adult now, somebody said, "What's it like going for a fresh start appointment?" And she said, "Well, first everybody hugs you and tells you you're beautiful. By the time you actually get to your doctor, you really feel good about yourself because all children, all people are beautiful. Everybody looks different. So they feel good about themselves."
I was talking to Dave before we met this morning, and we were talking about that exactly, is what are the chances of being born? Number one, it's like very slim to become who we are. Mm-hmm. It's a miracle. And how fortunate we are to be born with fully functioning everything, or no deformities, if you will. Mm-hmm. And but the folks that are born different are just that, just born different. Mm-hmm. And that's what, and what you just spoke to, I think is so valuable. And can you put a price on what you get out of what Fresh Start offers? Can you put a value on it? You can't. It's priceless.
You can't put a price on any child or person. And then also keep in mind, it's not just birth defects. People are in accidents. Kids are abused by the people that should have loved them and taken care of them. Kids, unfortunately, get in crossfire of people's arguments and become collateral damage. We take care of any physical or cosmetic issue, no matter what it's caused by. Everybody deserves to hold their head up high and feel that they have value. And though there is absolutely no price on it, I work a lot with the numbers. I brought my little pamphlet here, and I can tell you Georgina has had $60,000 worth of care. But giving her the ability with hearing aids implanted so she could hear,
right,
that is not worth $60,000. That is worth everything.
Priceless. Exactly.
You know, this little girl had a vision problem. Mm-hmm. She needs to see the chalkboard, or what do they use now? Whiteboards, or now the computer.
Exactly.
But to go to school, there is no price on your health. So am I telling you you're going to get a return 5-fold, 10-fold?
There's no
or a zillion
quantification
fold.
of it.
No.
And that's what I tell folks whenever I do talk to them about our programs with COBO Bottle, where we support, is there is the dollar value that we're offering as a contribution to Fresh Start. What you get in return is so much more. We could talk for the next days and days and days on how we make this happen, how we execute the financials, you know, all the time that the surgeons put forth, how great people they are, how great the patients are, and so on. But really when we really boil it down to what it is that you two and your organization is dedicated to, and the contributors, is what you all are offering is so priceless. And it's leveling, I don't want to say leveling the playing field, but it's offering opportunities that may therefore have not existed. And the essence of the anxiety and the stress that comes along with feeling down on ourselves about our insecurities alone, even as fully functioning and, born with all of our wits and no issues, we're still hard on ourselves, and folks are still hard on us. And we've lived through that, right? But those folks that you're helping have can see things differently now. And that is just almost like offering a miracle to someone, in my opinion.
Well, and the miracles go far beyond, let's talk about Lucio. Our founding physician, Dr. Dennis Nigro, who has since passed, was doing a screening clinic right across the border in Tijuana. The line, when in other countries, when they hear that there is a clinic, when a doctor is coming to town, they come for days. And the line was literally around the block. A mom, and as a mother, we are crafty and determined when it comes to our children. So Lucio had a very severe cleft palate.
Lucio is one of your current patients.
He is a graduated patient.
Cool.
And let me tell you how this went far beyond. So the mom took one look at the line, and she went the opposite way around the building, walked right up to Dr. Nigro and shoved her baby into his arms. He became a Fresh Start patient. He was a Fresh Start patient for many, many years into his 20s. He used to walk around saying, I'm going to be a doctor, I'm going to be a doctor. And he would play with all the equipment. We're very chill with the kids, touching and playing with everything. My fault. Lucio is now a general surgeon in Mexico City, and how many lives is he saving that are coming through that emergency room in Mexico City, whereas he might have choked to death as a baby had his airway not been straightened out and cleared.
I'm sorry. I just talked to Lucia yesterday.
Oh, cool.
We're in touch. So he had an interview he is done with his, like Michelle said, general surgery. He's going into his plastics residency, plastic surgeon.
Wow.
And he had to interview to different hospitals and different programs. He really wanted to go to the Guadalajara hospital. I'm sorry, I don't know the name, but he asked for Dr. Gosman. Dr. Gosman was his surgeon. After Dr. Dennis Nigro passed away, she took on his case. And he asked her for a recommendation letter. And I helped facilitate that, and she sent him one. And he just told me, I just want to thank you so much. I had my interview yesterday. It went so great. It went well. I just have to do the test. But I want to thank you and Dr. Gosman and Fresh Start, because without you, I wouldn't be here today. And that just shows what all the doctors, all the nurses, all the surgeries, everything that he saw as a young boy inspired him to do what he's doing today, because he wants to help people. He wants to help kids, and he wants to help people. Like Fresh Start and the volunteer surgeons helped him when he was younger. It's amazing.
So beautiful.
It is. And like Michelle was saying, our doctors, our plastic surgeons, they're so perfectionist. They want to do the best job they can possibly do. It's like a private paying patient. So it's not, oh, we did one surgery and you're done. No, it's till it's the best results possible. And going back to what you were saying, Logan, about, us being, we're fine, our kids are fine, but then we have our Fresh Start patients. You wouldn't know how many Fresh Start patients become friends, and when they come to our clinic and when they come to our surgery weekends, they feel at home because they see other kids that look like them, and they just open up and they can be themselves. No one is judging them. No one is pointing at them. No one is giving them those stares, which makes them comfortable and open up, because when you will see the difference once you start talking and once you start seeing them on a regular basis, when they come, they have no self-confidence. They feel like, I have no words. I mean, they just feel sad. And you start seeing them come out of their shell, and you start seeing the transformation before your eyes. That's the best part. That's my favorite part, seeing the transformation. You start seeing the young girls that before they would wear their hair down in a hoodie and you couldn't even see their face. Now they're wearing their hair up, they have makeup on, and they're just, it's night and day. So we see so many things that happen with our patients growing as developing self-esteem, growing and establishing relationships where otherwise they were in their own little bubble. And it's just amazing to that we get to see that and be part of it.
I'm so glad you shared that. It's innate in humans to want to connect, to be part of something. We want to be together. We want to share experiences with each other. We want to be accepted by the people that we want to be accepted by, or even maybe by all, and you've created a community, essentially, and a safe place for folks, and also solutions for them to be part of the community and feel confident in doing that. And you all have tapped into something that's so innate and instinctively human, in my opinion, and you're helping folks connect with that. And your doors are open still right now. Like, you don't have enough patients. Is that where you are now? So sorry. What I'm trying to get at is this is a powerful thing that your organization is offering, not only to San Diegans, but to the world.
To the world. We have the capabilities because every single kid doesn't need surgery or services on the exact same day because, for example, like a cleft palate child, their teeth sometimes their teeth fall out, their teeth come in. So it's scheduled out. Because we have such a good relationship with Rady Children's Hospital where we host the surgery weekends, they have 16 ORs. They hold back a few for emergencies, but they don't use them on the weekends. We have free run over 12 state-of-the-art. Rady Children's Hospital is top 10 hospital in North America. So that includes Canada and Mexico. Our surgeons want to do fresh start patients. They take a weekend out of their month and take care of them. So we really are, one of our biggest challenge is reaching out to the community locally and across the country and letting them know that we are here for your kids and we can help and weave them into the schedule, especially we're very well known outside the country. They Google different doctors. It's a doctor network like all across the world. They start referring kids to Fresh Start. But right here in the United States, I feel like we're just a little challenged on our patient outreach.
And I could be wrong, but if I were to guess, the most need is not in the U.S. because we have good, solid medical, let's say, insurance, employment levels are pretty high, I guess, and folks have enough money or insurance coverage to handle, prior to COVID, to your point that you were making before. So I'm wondering if globally you're getting more references because of that, or?
No, I think because there is a lot of conditions that insurance does not cover here in the United States that would cost hundreds of thousands of dollars. Let me see if I have a picture of, there is a condition called amniogenesis imperfecta. I just happen to have a beautiful girl named Stephanie here. So this is a genetic defect where your body does not produce enamel to protect your teeth. And so through no fault of her own, her teeth were just crumbling. It wasn't because of poor hygiene. There's the camera. It wasn't because of anything. It was a genetic issue. So dental insurance covers like $1,000 a year. Not going to cover it. So Stephanie, who now has a gorgeous smile, it's all implants. Her care over 25 different dental clinics would have cost $65,517.
I can attest. I have $15,000 worth of implants for 2 teeth in my mouth.
Surfboard?
No, I boxed growing up. But
okay.
Yeah.
So her her parents were hardworking individuals right here in Vista. They didn't have $65,000. She's a twin. We took care of her and her brother.
They both had the condition.
They both had the exact same condition.
Oh my gosh.
They are both thriving individuals. But when Lupita was talking about kids that walked around with their head down, with their hair hanging in front of them, talking with their hand in front of their mouth, I want to say, who has a couple $100,000 for their child? And we're here to relieve all of that anxiety. And how long were Stephanie and her brother patients?
They were patients for a couple of years. I want to say maybe 4, 5, 6 years.
It's a long process. And so that is something with working people right here in San Diego area that were insured that they just didn't have the coverage, and they were really at their wits' end.
That's really impressive. You say, I bet it did take 5 or 6 years. My two here took 2 years and, like I said, $15,000. And I wasn't able to fill that gap in my mouth for about 3 or 4 years. It's right up front.
They had to get braces as well. So it took a while.
That's why, you've got to do a lot of stuff to make that happen. I went through nothing like that, but in order to for me to understand, going for years with a gap in the front of my teeth right here as a 20-something, you don't have the same conversations. You don't go, you think twice before you leave the house. You think twice before you smile. You think twice. I can't even come close to imagining. And what you guys offer is always blowing my mind for this reason.
So here's another situation. Here's a beautiful little girl that had a cleft palate. But let's talk about birthmarks and port wine stains. Insurance really does not want to cover things like that. Little Casey had a birthmark covering the majority of her arm, and this was a lot of work to remove. In fact, one of our Fresh Start doctors that's based in Chicago, Lupita took this is the kind of white glove service the Fresh Start patients have. We just didn't put Casey and her dad on a plane to Chicago. Lupita accompanied them, made sure that everything was translated into Spanish for them.
Oh my gosh.
And stayed with them during the treatment. We use very sophisticated procedures. So back even 20 years ago, for a big port wine stain or hemangiomas, they were surgically removed. Now we're using high-intensive laser treatment. So we have a little girl that has a port wine stain covering the majority of her face. What is she, 2?
She's 2.
She will start kindergarten none the wiser. We are putting her under anesthesia and doing high-intensive laser treatments to her face, and it's clearing up really well. And so the kids get the state-of-the-art care.
For free.
For free. Okay, let me tell you.
I just can't get over it. I'm sorry.
About Casey's little case. So I included a picture. So this is called a hairy nevus. So the birthmark goes right through the skin. It's not a surface thing. So what they did was they put a tissue expander in the side of her tummy to grow nice, soft tummy skin, who has a softer tummy than a little kid.
Yeah.
And then the doctor surgically removed the skin holding the birthmark on her arm, tucked her arm inside her tummy so it would just naturally become used to the skin and start adhering to it. And then, what was it, like 3 or 4 weeks? Maybe longer?
Maybe 6 weeks after.
6 weeks. They separated her arm from her tummy, finished like a sewing project. The kid's got a gnarly scar running up and down the side of her tummy, but we're taking care of that. We do the scar revision. We don't tell the kids, oh, a t-shirt will cover that. So she's receiving laser treatments, but look at the smile on her face. And
that's science at its best.
that was what we gave a Fresh Start patient at no cost. And we have other kids where they've got the birthmarks on their face.
That's a good picture. Can you hold that one up a little bit higher for the camera? Yep. So that's an example of not port wine stain, but a birthmark. Yeah.
Covering the face. So a lot of this is above and beyond. And you've been to the hospital and our clinic. So our idea of a clinic is not a trailer behind a community center.
Sure.
We have
it's
a
state of the art.
7,000 square foot, 22 room, state of the art clinic. These kids are seen, basically, they walk in on a red carpet and get the white glove treatment. And we do it because we can. We have the capabilities, we have the time, and we have the will to help kids and families that literally would just be stressed beyond belief.
And now more than ever domestically, we're facing kiddos and families that are without the resources and the funds to address it.
Yeah. So when the economy stopped,
with
kids,
the pandemic,
yes, with the pandemic, when the economy slowed down and in some places ground to a halt, apparently the kids and their medical conditions didn't get the put that on hold memo. And honestly, it's a great time for kids that live in the United States to apply for help, because if they're doing online school, they can do it. You know, they're not going to miss days of school.
It's an opportunity. It's
Let's
a big
take the
opportune
opportunity.
time for folks in the U.S. That's a great point.
And if they live locally, if they live in the U.S., we don't have to do any paperwork. I mean, they could jump to the front of the line. We don't have to do visas. We don't have to do passports.
Yeah.
And the capacity is there in your process.
Right. Because the kids that were already in the system, because, so let's just elaborate a tiny bit. If you are a long-term Fresh Start patient, that does not mean you are in San Diego for years upon years. You go home a couple weeks after your condition and come back 6 months later. It's an ongoing process. So you're not really, yes, you're getting to the front of the line, but you're not taking anybody's space right now because of travel restrictions. The other thing that we'd like to talk about is we do not take government funding, which means we are free to accept any any patient that fits the Fresh Start medical criteria and the financial criteria. So if your little feet are in the United States, no matter how you got here, you may apply for help without fear of any
Being
immigration
rejected or immigration issues.
So if you live outside the country, you do need to go through the visa process. Lupita has an excellent relationship with the visa offices, and essentially all kids that need help do get to come for help. But right now, if you are in the United States and do not need to travel, and really it's easy, almost anything is a Southwest flight into San Diego. We help with
Especially
the travel.
now.
Yeah. My daughter flew from Chicago to San Diego when the pandemic hit on an empty flight for $35.
Sure.
So you can be a little opportunistic right now and get your child the help that they need.
How, I know you said it at the beginning, but this is an opportune time. How can folks, what's the best way to get in touch with you all?
The best way is they can go to our website and complete the application. Again, it's www.freshstart.org. They can, on our website, it has our personal emails too. They can email us directly, but if they are applying for services, they can complete the application, and then the application comes to our portal, and then we review the application. But again, my email's on website, but they can email me at lupita.org. Sorry, no, Lupita.
She's her own company.
Lupita at freshstart.org or Michelle at freshstart.org.
Can you spell your name?
Lupita, Lupita.
Perfect. At freshstart.org.
Yes.
Perfect.
We're very easy to get in touch with personally. In fact, we don't even have a receptionist.
Right.
You call, we answer the phone. And we do like to, the application can be a little overwhelming. And so if you take a look at the application and you're not sure what something means or how to request medical records, I would say give us a call. Let's chat about your child's condition, how the whole process works. You can review all of our doctors, an entire medical volunteer team on our website, and there's links to all of their private
Credentials
practices
and private practices and so on.
So you can see
the legitimacy of the service, of the care that's being provided to the patient.
Because people are nervous about their children to begin with, and you want to make sure that you're in the best possible hands and the most capable hands. If my children needed something, in fact, I would want to be a Fresh Start patient.
Right. Fresh Start isn't it's not a charity service that you're offering. It's not charity care.
Right.
It is
highly specialized medical care that we do not charge for.
That's right. And that is what may be a bit daunting in the beginning, is that there's a charitable organization that's going to be providing my child with surgical care on some major surgery. But here's the thing. We've talked about real deal cases, all success cases. And I think, the thing is when you have top doctors in this country working on folks and volunteering their time for free at top 10 rated facilities, you can't go wrong with that. And you have someone, a group, a team of folks walking you through the process. You have a place to stay. You have folks looking out for you at the place to stay. I want to be a Fresh Start patient too. If I needed it, it's unbelievable.
It really is. And the other thing is, if you want to weigh 500 pounds, volunteer for Fresh Start, because all we do is feed you. You've seen the buffet.
Yeah, I went back for seconds and thirds.
It was really nice. Logan and the COBO team came out for the Fresh Start experience, which we should be able to give in a few months. We're going to hit flu season. So I'm going to say
some restrictions there.
Some restrictions, but it's a very festive atmosphere. The volunteers are running into their friends that they haven't seen for a few weeks. What I always say, and I feel like I'm a repressed real estate agent or museum docent, because that's my favorite thing, is to give the tour and meet the families. And one of the most breathtaking things is, in addition to the families and the children that we're helping, when I tell you that every single person on that floor at Rady Children's Hospital, no matter what their badge says or their lab coat, private practice, whatever hospital they work for, those 100 people are volunteering for Fresh Start for the entire day. They came in on their day off. We have volunteers that look at the Fresh Start schedule, because we publish it a little over a year in advance. So people have planned their weddings so they don't miss a Fresh Start surgery weekend. Wow. And we're very mindful. We skip the holidays. We pay attention to when high school and college graduation is. But our volunteers, have we ever lost a volunteer?
No.
Diehard volunteers.
We have volunteers that have been volunteering for over 15, 20 years.
Wow.
We have volunteers that have moved out of state and come back.
Yes. We have volunteers that drive from LA to San Diego on a surgery weekend, on a Saturday morning. We have volunteers that fly in from Arizona.
It's crazy.
Well, you've got one contributor and volunteer on your list here for good. You can count me in. And if folks want to volunteer for Fresh Start, they can also go to the Fresh Start website.
Yes, or they can email me directly.
Email you?
Lupita
Okay.
at freshstart.org.
Or click on the volunteer page.
Michelle was saying on a surgery week, and what I try to do and the team is we try to make it a fun day for them, because they're already working long days every day, 12-hour shifts, 14-hour shifts at the hospital, and they still find the time to come on their day off. So we don't want to make it like, oh, another day of work. It's a fun day. We have raffles, we bring in food. We just make it very like a party. There's a party in the lounge, so people look forward to that. And
I can attest to that. I interacted with everyone. I like to talk to folks, and we were interacting, and everyone there was so cheerful and happy and so proud to be there.
Yes.
They're really proud to be there. And my next question for you is, if contributors, donors want to get involved, they want to support your cause, I highly recommend it. First of all, if you want to support the cause, I would say if you want to DM us, message me anytime if you want a point of reference on my experience with Fresh Start. But if someone does want to be a donor or contributor, what's the best route to get in touch?
Again, Michelle at freshstart.org.
Perfect.
Or we do have a donate button right on the website if you want to just be a little more anonymous about it. We love to talk to the donors, and we keep you updated. We share the patients' stories with you. We're the organization that loves you back. Without volunteers and without donors, scores and scores of kids, hundreds of kids would be going without medical care that they need. We are the most comprehensive organization that does what we do. In San Diego, we're like a plug and play. The doctors show up, they don't have to plan. All medical professionals do pro bono work, but the extensiveness of these cases make it cost prohibitive for them, because they would need to assemble a team. So if you need cranial facial reconstruction, you also need a neurosurgeon. You're going to need an ear, nose, and throat surgeon. So what we do is we assemble the teams for you. You show up and do what you do. If you are Zach and your job every surgery weekend is to make sure Michelle gets her old-fashioned maple donut, you are at Peterson's Donut at 5 a.m.
I get it.
Picking it up. If you are a neurosurgeon, you walk in, scrub in, and do your neurosurgeon thing. We make it very easy for the medical professionals to do what they do well and what they love to do. And they do all the follow-up themselves. So after a surgery, the child will need to be followed up just like it was a paying patient. And so they're driven to the private practice of the surgeon, and their file is always a Fresh Start patient, but this saves the surgeon having to go meet the child at the clinic.
Sure.
We make it super easy, and they just really have that good feeling about not only saving that kid's life, but in Lucio's situation, they almost they made it possible for every kid that walks through that emergency room in Mexico City's life to be saved as well. It's, really, I'm going to have to change my whole value proposition after.
I'm in. Hey, I'm in. You're talking about family. We're giving a gift to folks that they could not receive in any other capacity, potentially. It's a well-oiled, highly professional, expert team of experts at facilities that are state-of-the-art. You almost can't ask for anything more from a charitable organization that does what you all are doing. And that's why we picked Fresh Start personally.
Well, we just want to thank you. I mean, this partnership, and we view this as a true partnership. When we have a golf tournament, Logan's team is out sponsoring they bring their entire trade show setup, and Logan has some Texas game. I thought it was toss across, but
no, it's washers. It's a little hillbilly, but it is what we do for fun when we're out by the rivers and the lakes and the beach.
But anytime we need something, we needed bottles for the Red Nose Run, they were there. And we in turn really try and promote all of Logan's companies. And this is a great gift that you're giving us for all of you listeners out there. This was us learning how to host a show. And going forward, Lupita and I are really looking forward to not taking up your time, but doing it ourselves and bringing in some doctors. And when things settle down, bringing in the dermatologist that's taking care of Andrea's port wine stain, and really talking about how these things happen, drawing the curtain back and showing what's going on behind the scenes, and featuring different volunteers that are in San Diego making this happen, and different donors. We have donors from all walks of life. We have kids that are donating, their bar and bat mitzvah money to Fresh Start, or monthly donors. We have very large 7-figure donors, and everybody has a story to tell. And what I love about our donors, I was with one of them the other day having a socially distanced meeting outdoors, and somebody he knew walked by, and he invited him to sit with us. And he was talking about Fresh Start, and he said, "This is what we do." He is with a financial contribution, you become part of Fresh Start.
It's a family.
It is a family.
That's why I say it that way. It really feels that way. Not only for the patients, I saw it on their faces and in their interactions with me and my team when we came to Surgical Weekend, right? The volunteers, they felt like they were part of I felt like I was part of that family that day of, and it was the first time I've met them. Mm-hmm. Everyone was so open, smiling, and so proud to be there doing what they were doing. And thank you, Michelle, for the good words. And I can't say enough good things about you. And I think it is a great idea for you all to proceed in shooting a regular podcast here at the COBO Pod. And again, we are more than happy to offer our time, editing services, and everything for you and the organization and an indefinite commitment. So thank you for the good words. And we are excited to see what comes of it. And we're excited to see how you all evolve out of the pandemic sort of situation. And it sounds like you've got a good, solid plan. And however we can help, we're here.
Thank you.
I want to say thank you for having us. Thank you for thinking of us. And thank you for choosing Fresh Start as your charity of choice. And we're excited. We're excited to share and let people know what we're about, and also share stories. I think that it's important that stories that people can relate to. I think that in the future we can share on family, because when a child is born with a deformity, it's not just the child, it's the whole family that it affects. And there's a lot of family dynamics that happen in the process. So
I couldn't agree more.
I get to see that side of things, and it's a big thing. But at the end of the day, it all works out, and it just makes them stronger, and it grows. It makes them grow as a family. So I really want to share on that in the future, and I'm really happy to be here and just be part of this. And thank you for inviting me. Thank you for having me. And Michelle, thank you for leading us and for making this happen.
Yeah. I'm excited to see what comes of those conversations, because you're right. You're right. It's much bigger than Surgical Weekend. It's much bigger than the day of. Every single thought step after those surgeries, one more element of confidence in someone's day spreads to the family, the brothers and sisters, the mothers, the cousins, and then their careers and every friend that they make after that. I'm really looking forward to it. So happy to help.
Thank you.
All right. Well, that's a wrap, folks. Thank you, Dave, and thank you, Peyton, for your time. You.